going on, guys? So for the sake of the discussion today, I just wanted to highlight that we're not discussing tightness in the context of clear tissue injury or post-surgical or things like that, but rather referring to the cases where you woke up and now your hip flexors feel tight, or you've been experiencing generalized tightness that tends to pop up now and again and you aren't sure why. So oftentimes when people have these sensations, they immediately think that there are knots or truly tight muscles that need to be either released or stretched out. The confusing part of this is when we take a deeper dive into assessing these people, the muscle or joint is usually able to achieve full range of motion, or the area was already restricted before and no tightness was occurring or felt by the person at that time. So what's going on here? Well, this is where we have to recognize that tightness is a perception, which is influenced by many factors and is more of a nervous system thing than a mechanical thing. And one way to see how this works is to consider getting amped up for an important event that you might be nervous about. Generally speaking, in this context, your muscles are taut, and your nervous system does this to get you kind of ready for action. So we can see how tightness is then influenced by many factors such as the environment, stress, sleep, and also the mechanical factors such as being in one position for a prolonged period. In a physiotherapy setting, we might consider all of those factors, see what's relevant to you, and whether there's anything that needs to be changed or not. From the standpoint of understanding how what we do works to change tightness, what we're really doing is we're altering perception. So consider this. What is the first thing you do when you hit your shin? Well, most of you probably said one of two things. Either one, you grab your shin, you rub it, or you yell some choice words. Both of these things work, but both of them don't really change much in terms of the actual tissue. But what they do is they alter perception. So tomorrow we'll show you an example of neck tightness and some options along with that we might approach this with an explanation of why we might prioritize one approach versus another. So thanks for listening. Hopefully it was valuable, and feel free to ask any questions in the comment section below.